All right, good morning, everyone. Calling the Southborough Board of Health meeting to order on Tuesday, September 17, 2024 at 9:01 a.m. All board members are present. So first order of business is public comment, but we don't have any public. And I'm actually going to move the agenda around a little bit because we have some people who are popping in to join to speak to us this morning. So if you guys are okay, I'm just going to skip over minutes and go actually directly to the opioid abatement strategic report overview, which is number 12. Is that okay with everyone?
Yep.
Great.
Yep.
So I'm going to bring Emily and Isabella over.
And then if you can give Emily privileges to share her screen.
Okay, perfect. So Emily, I don't know if we've had her at a Board of Health meeting before, but she is our drug-free communities person for both Northborough and Southborough. So Southborough, you probably have worked with Emily, but Liz, I'm not sure that you have. And Emily, you've been here a year?
Since last December, so coming up on like I think 8 months or something.
Okay. And this was a new position for our towns since we got the drug-free communities grant. So and then Isabella Caruso, I think you're all familiar with. She's the Northborough newly merged department head of youth and family and health department. So health and human services, right, Isabella? Okay. And as part of Greater Boroughs, we did the 4 towns contracted out with some excess grant funding, not related to opioid settlement funding, to do the public outreach that's required as part of the opioid abatement funds. And Emily and Isabella have nicely put together some information for us that kind of summarizes the full lengthy report that we received from the consultant. So we asked them to come this morning and present to us. So that's your little intro.
And thank you very much for putting it together.
Yeah.
And presenting.
Yeah.
Oh, and you want privileges. Okay.
Yeah, so I basically took the report and I consolidated it down to a couple slides just so that's easiest for us to just quickly go through it. And once I'm able to share screen, I will share screen. But it's nice to meet you. I mean, I've met you all before, so nice to see you all again. But let's see if it's letting me.
I don't think it is yet.
Yeah.
I'm struggling with this.
No worries. I guess just to get into it a little bit, just like on the surface level, the opioid abatement assessment was a pretty wide community effort. A lot of different people were talked to, a lot of different groups were held and discussions were held to try to get the most accurate depiction of what people in the community think we should be focusing on when it comes to substance use and substance use prevention, as well as treatment and recovery. 2 very different sides of the spectrum, I guess.
Emily, do you want to send me the slides and I can try and?
Yeah.
Why don't you try and give me privileges right now, Chelsea? Or if we can.
It's not coming up as like an option for me to.
Can we send it to you?
Yeah, do you want to send it to me?
I should send it to Chelsea over email, or is there a chat function? Okay.
Sorry to interrupt you.
No, you're fine. Chelsea, would your email just be C
Malinowski.
Malinowski at
SouthboroughMA.com.
I have too many emails. Or you could do NSBorough if you need to do that one.
SouthboroughMA.com, right? It's not
Yes.
.org.
Right.
All right.
Thank you.
And I want to make sure I spell your last name correctly.
Emily, you can always CC me just in case, and then I can always forward it on.
Okay. Yeah, I don't think I've ever emailed you, Chelsea. So it's like not popping up, but it just sent.
All right, thank you.
Some sort of an anonymous anteater just popped up on the slide deck, so hopefully that's perfect. Okay, so yeah, we just have some data here. Opioid abatement assessment, essentially that's just the title of the report. Southborough and surrounding communities, this is for all the towns in the Greater Boroughs Partnership for Health, so Southborough, Northborough, Westborough, and Boylston. I've tried to focus mostly on Southborough, but sometimes the data was just like Algonquin is Northborough, Southborough. So when we talk about youth, we're talking about both towns essentially. So in summary, alcohol and EVPs, which are electronic vapor products, it's likely talking about nicotine. Unfortunately, when you ask about this substance, it's asked as an EVP and it doesn't ask about the specific substance, which is like really frustrating from a data point of view. But it's most likely talking about nicotine vapes are most common among youth. Just under half have used alcohol in their lifetime, and about a quarter have used it in the past 30 days of this survey, which was in November of 2023. All use of all substances have declined since 2018, except for alcohol use in Westborough middle school students, in which lifetime rate actually doubled. All communities in the Greater Borough Partnership have a similar rate of adult binge drinking. It's slightly higher than the national average, but not like worryingly so. It's only a percentage point. But we do have a lower rate of adult lifetime cigarette use than the state and the national rates. So doing good with that. And one of the populations that we do try to focus a lot more individual attention on is female students and students that identify as LGBTQ+. These students just demonstrate a higher usage rate of all substances across the board, and they're also at greater risk of developing substance use disorders.
Devin, I don't know if I missed this. What's the response rate?
The response rate of the Metro West. So this is all data coming, or I guess with all youth data, it's coming from the Metro West health survey, which is conducted twice a year in the schools, and the response rate is usually upwards of 95% of students.
Wow. Okay.
Yeah. So they have a pretty good response rate. Usually the students that aren't included are absent that day. There's a very low rate of parents withdrawing their students' consent. So this is kind of just like a visual representation of that. You can see that alcohol is by and large the most common substance use. It kind of towers over every other substance, and that's pretty standard for all youth substance use. It's just a matter of access. It's very easily accessible, and it's a matter of how we as adults kind of demonstrate it in society. We make it look like it's fun and it's really not that big a deal. And so students and youth kind of take that lead from us. But in Algonquin, we have lifetime use versus current use. Current use is just use within the past 30 days. That's a standard measurement that is kind of the gold standard for substance use data and research. Past 30 days use is just a really good indicator of what's going on currently with students. And again, this is from 2023 around the November time period. And then this is just lifetime trends and past 30-day use trends. If you look across all substances, we're going in a downward trend. Vapes spiked a little bit in 2018, which is around the time that they started getting really popular. And that's also around the time that we saw a legislative ban on things like Juuls. So following 2018, it decreased again, but they definitely hit peak popularity in 2018. And we kind of responded with policy. So that kind of tapered that off. But across the board, all substances are decreasing. We thought we'd see it spike following COVID, but we didn't. So that's a good sign.
That's so interesting.
Yeah, not sure what's going to happen when the kids are back in school, and they didn't experience a big disruption due to COVID, but we're doing okay. So
This is so interesting, especially around marijuana use with legalization coming into play and this big concern that we'd see an uptick in youth engagement as is more readily accessible, and not seeing that has been interesting. Huh.
Yeah, it is really interesting. I think, or Safdar, did you want to add to that?
Yeah, I was going to say, on the ground, and we talked about this a little bit, the experience has been very different. on the ground in terms of this. And one of the thoughts that I had was is just are more like while rates are declining, are more parents actually letting us know that their kids are using and seeking help. I feel like I see so much cannabis use disorder and alcohol use disorder, but if the numbers are going down, and this is a statewide, I don't think this is unique to our district necessarily either. I think, and I think part of it maybe is that are people getting noticed more um, for this, and it could be. I guess we don't know. We don't know, but
Yeah.
it does seem like you're right, Liz. On the ground, it seems like these rates are higher than what we're seeing that this data shows.
Yeah.
Chelsea, if you want to go
Yeah.
to the next slide, thank you. So now we're just going to go into kind of like the different types of ways that we look at substances, both through the grant that I manage and also just in general, like substance use data collection. One of the biggest points of kind of when we look at youth substance use specifically, one of the biggest points is access points. So we do ask about the access in the Metro West Adolescent Health Survey, and we also ask about it in our focus groups. So just about half of students state that it's very easy to access EVPs. Again, those are electronic vapor products. Electronic vapor products could be a bunch of different substances. It could be nicotine, it could be THC, it could be CBD, and it could be just flavored vapor. A lot of kids just do that. Not sure why, but they do state that's very easy to get a hold of these, despite the fact that they are pretty legislatively protected. Just under half report that very easy to access marijuana. Focus groups conducted by Encompass reported that alcohol is easily accessible through friends and family. 65% of the students who have had alcohol in the past 30 days reported that they get them from house parties. House parties are very popular in Northborough and Southborough. That's what we hear a lot from the students and also from our law enforcement. And 44% they get it from their peers. So peers implies that they are getting it from someone their age. It's not really implying that they're getting it from someone over 21. So when we probed at that a little bit deeper, when they get it from their peers, do they know who their friends are actually getting it from? It's most commonly from their parents without their parents' knowledge. So they're either taking it from their parents' liquor cabinet. Another equally, it was like 28% does without their parents' knowledge, and 30% do with their parents' knowledge. So we do also have a problem of parents providing alcohol for their kids. We have a youth coalition that has told us that if you don't have parents that will give you alcohol, it's very easy to find a parent that will. There's always a friend that has a parent that's cool with giving, a rack of beers or some like ciders or something like that. And as long as they're drinking in their house, they're okay with that. We also have a large number of kids that get it from people over 21 that they contact on social media, usually Snapchat. So next slide, please. Thank you. And then perceptions of use is also a really important thing in our community. More than half of parents believe that most high school students drink alcohol. I really want to emphasize that this isn't true. We have an incredible group of youth that live in our towns in Northborough and Southborough and Westborough and Boylston. We have a really great group of kids, and 8 out of 10 students haven't had any alcohol in the past 30 days. This was when it was conducted in 2023, of course, but again, this is the most accurate measurement that we use for substance use. So you look at that data of more than half of parents believe that most students are drinking, 8 out of 10 aren't drinking, and 10% believe that their own kid has used alcohol. So it's kind of like this dichotomy of opinions. Like, I think all kids drink, but my kid's not. But in reality, most kids aren't drinking. And that perception really kind of drives forward the social pressure to drink alcohol, especially among the kids themselves. If you tell them that 8 out of 10 of their peers have reported not drinking alcohol, they're like, there's no way. Everyone drinks. That's not possible. And it's like, well, no, because when you're left alone in a room to answer these questions, you're saying you don't drink. So, like, but moving on to like the perceived risk of harm. According to parents, alcohol is the reported greatest risk of harm, whereas vapes present the lowest. But when you ask the students, they think that vapes present the greatest risk. And alcohol is the second highest, but marijuana is the lowest for both groups. So marijuana is not really seen as a threat for parents or students, whereas students are reporting that vapes are really high risk. And I think that shows that there was a pretty successful education campaign there. They are really worried about the risks that vapes can pose to their lungs and their heart. Not so much about alcohol. They think that alcohol probably won't pose a lot of harm to them, which is interesting because I feel like we've done a lot of education on alcohol, but that's fine. We'll keep going. So next slide, please. And then community norms. Northborough and Southborough have a pretty significant community norm of a rite of passage attitude. If you talk to the parents through the parent survey and when we engage with parents at community events, there is kind of an attitude of like, well, when I was young, I drank alcohol, so I think it's fine if my kid drinks in my own home. We did have a parent survey that showed a significant portion of parents think that their child would drink in college anyway. They prefer them try it at home, so they provide alcohol to kind of like drink in their basement. That's like not true. It's kind of like a false I guess, sense of security when you provide a high schooler with alcohol to prepare for college. It's just like not as effective according to the data. SAFTR is like, please don't do that. But parents are really unsure of how to start that conversation and address the problem of substance use with their children, and that's completely understandable. It is a really awkward and difficult conversation to have. So we are trying to start an education campaign for the parents of how to start those difficult conversations with their children when they're as young as 9. So by the time they get to high school, they're really open to having these conversations with their parents, asking these questions and kind of like talking about boundary setting, because the kids are going to be offered it. And refusal skills are going to be really important. They start with the parents. There's also a significant not my child mentality and stigma that's reported by the youth. A lot of the kids reported that they have tried alcohol, but they don't want their parents to know because their parents think that they have never, and they've heard them talking to other parents about how they haven't, and now they're kind of like in this hole of like, well, now I can't talk to my parent about it because they're telling other parents that I don't do that, and I have. So that was kind of a difficult, I think, topic for the kids in the focus group to talk about, but we're going to go into a little bit more of the barriers. So most adults reported that they feel that the towns offer adequate resources in the community for someone seeking help with substance use. There's resources in the schools, there's resources in the town governments. The judicial and law enforcement system also offer a lot of different resources, especially for youth substance use and youth that are like caught with substances. Multiple treatment and recovery programs in the region. In Westborough and Southborough alone, we have a couple. And in the central Massachusetts region, there are a lot of different resources. 55% of parents report that they do feel comfortable knowing where to get substance resources if they need them, so that's great. But the youth reported that they were unsure of how to locate a trusted adult for support. So we do have a lot of resources, I think, that are in the parents' faces and adults' faces. Like if you or a loved one or a child are struggling with this, these are your options. But the youth are reporting that even though they have these options, these companies, these brands, they don't feel like they have trusted adults. And trusted adults are where they're going to go to for support before things get out of hand. So I think it is important that we kind of focus on that a little bit. And again, stigma comes up in every conversation. There's still a lot of stigma towards substance use, and that's just kind of like the way it feels right now. I think that's something we can work on a lot. So, and we're trending positively for that. And then finally, crime. Most violations for substance-related crime are possession and concealing. Narcotics are most frequently seized drug, followed by stimulants. Northborough and Southborough have the highest number of arrests for driving under the influence, and there was an increase between 2021 and 2022. So that is, I work in prevention, so crime is like outside of my wheelhouse, but I thought it'd be interesting for you. But that's kind of concerning, the DUIs. Definitely gonna have to do something for that. So and then in the final kind of point, community needs and concerns, when you're talking about substance use, a lot of other topics come up just because it's such a dynamic issue. There's a lot of things that contribute to substance use that aren't necessarily just like putting a substance in front of a child or an adult and saying, here you go. Bullying, cyberbullying, and social media were the #1 concern brought up, especially by youth. Kids are stressed out, and they're also stressed out about what they see online. So it's a lot of comparison, and it's a lot of that social driver of that pressure to drink. If you are scrolling through social media and a bunch of kids have Finstas, which are fake Instagrams, and they're posting what they're doing on the weekends, and maybe they're drinking, like maybe you're like, oh man, like maybe I should try that. And so there's a social driver, and there's just a lot of I guess, comparison going on. Tobacco and alcohol advertising were brought up by adults. There's just a lot of tobacco and alcohol advertising. And the whole point of that advertising is to make it seem like an enjoyable experience. So it's pretty successful in doing that. Lack of adult supervision and youth vandalism was brought up. There wasn't a lot of data on that. So, But homelessness, food insecurity, lack of affordable housing, and lack of continuing healthcare, those are consistently being brought up more and more. And we live in kind of a rural area. So I think lack of affordable housing and homelessness are going to be kind of those dynamic issues that keep increasing. Domestic violence and mental health, those were also brought up in terms of the youth and the things that might drive them to try different substances in a stressful environment. And that's it. That's your crash course on substance use in Northborough and Southborough and Boylston and Westborough.
Thanks, Emily.
Yeah.
Any questions for Emily?
Thank you, Emily. That was like really nice, concisely presented with a lot of data. Thank you.
Thank you. I hope it wasn't overloaded because that report that's juicy. It's
Really
a juicy
long.
report.
Yeah.
So
Yeah,
Um,
one of the things that really struck me was when you talked about in that slide about the driving and everything else, and that really struck me, and that's a huge thing. If you see rates going down slightly, but then you see driving under the influence going up.
yeah, it's definitely interesting. And actually our youth coalition and Encompass,
Mm-hmm.
they are working on a campaign right now for social norms, and they really want to do it on drunk driving. And when we look at the data, the youth aren't participating in drunk driving. Like the campaigns for that have worked really well for youth understanding the risks of that, but they're really nervous about it. And so I'm wondering, like, what are they hearing or what are they seeing that they're pretty concerned and they want to do it on that. So it'll be interesting to see what they come up with for that.
My thought is I think they see adults doing it, adults driving after a
Yeah.
few drinks, and that's what they're worried about. And then, with the driving under the influence, I don't know how much a cannabis use and influence too, because that's definitely going to become more of a problem, maybe more among adults than youth if youth are using less. But I don't know if
Yeah.
that was specifically addressed. But we don't have any dispensaries, which is good. But our surrounding towns have a lot of dispensaries, so it's.
Yeah, for sure. That'll be interesting to see.
so, oh, go ahead, Chelsea.
I was just gonna say, I wonder why the youth are more concerned about vapes being more harmful than alcohol. Like, that's interesting to me. And what opportunities do we have to get into that deeper? Because it doesn't sound like they're doing it as, 8 out of 10 aren't doing it, but they still don't think it's as big of a risk as vape. So I'm interested in that.
Yeah, I think that's something we can probe on deeper in our, we have 6 upcoming focus groups with the youth in the schools, and we ask about, we ask our substances are alcohol and nicotine. So nicotine, we ask about vapes, but we do ask about perceived risk. And I think that's going to be interesting to hear because we did see that spike in usage in 2018. And then there was a really strong, like hard hitting campaigns against them. All the things like how they affect your brain, how they affect your lungs, how they affect your heart, like all these things. And then you see that decrease. And I think that was a really strong campaign. But you also have, I guess, the added bonus, I guess, with vapes of being that parents probably aren't vaping because they're not very popular unless they're using them as a cessation tool for smoking cigarettes. So you don't have that added pressure of, well, my parents drink every night when they come home from work, and I go to soccer games with my parents and they get a beer and that looks like fun. You don't have that like added modeling with vapes. So I think there was that spike when it was really cool on social media to have it. And then there was that decrease when they were like, well, actually, no one really does this. So I'm gonna stop doing it. But I don't want to put words in the kids' mouths, so we're gonna ask them. But like,
Great.
No, I think that's true because again, every survey tells us adults are the number one influence, and this is exactly what Emily said: is we as adults campaigned so well against nicotine vapes after 2018, and alcohol, like you said, Emily, the modeling of alcohol is right there in the community. So
yeah. Plus, I think it's gonna be really interesting for the next Metro West Health one that's happening next year because now we're gonna have different nicotine delivery systems. We're gonna have the oral pouches for nicotine. We're gonna have like a lot of different types of nicotine delivery. And I think vapes aren't as popular now because you can see when someone vapes, you see the little cloud. With an oral nicotine pouch, you can just put it in your mouth. And a lot of the kids are doing that because it's really well hidden from teachers. So that'll be interesting to see how that changes the delivery system for that substance. Elizabeth looks worried. and I'm worried that I'm scaring her.
No, I mean, it's scary. I mean, I got young kids, I'm scared.
You shouldn't be scared. It's not, I promise. It's
Like, what are these
controllable.
delivery systems? I didn't even know about them. Like, Jesus.
I have some materials I can send you if you'd like. But yeah.
So, the reason why we did this report, which, like to Emily's point, was very, very lengthy and had a lot of meat to it, was because part of using our opioid settlement funds required us to gain insight from the community. So that's what we did, and this is kind of the outcome of that report. And so I asked Emily to come and speak on this because the next thing that we need to talk about is the opioid task force as well. So
I think we should just do that now.
Yeah.
Because we're on that topic.
So, you know, we to date haven't spent any of our opioid fund money, mostly because we're waiting to kind of do the steps in the correct order, get this buy-in and feedback from community members, and then go from there. So because, and I don't know what it is in Northborough, but in Southborough, the Board of Health took charge of overseeing this money. So I've been asked by quite a few people now to kind of start thinking about putting together like a small group of people in town to see, you know, based off this report, and then also what, you know, we're seeing day to day, what we should be spending our money on. So we just kind of need to talk about this piece a little bit.
So any initial thoughts? I mean, we have a few years of funds right now, and every year I think the funds get less and less. Is that right? On the amount that we're gonna get.
Yes.
So, you know, I think this touches a variety of areas. Obviously, Board of Health is one of them. Emily's role is another one. Mary Ellen Duggan with the schools is another, and then you have youth and family, fire and police. You know, I think there's a lot of different stakeholders. So I don't know if we kind of want to put a group of those folks together to bring something back.
And then because we have a shared school district, we had also talked about kind of pooling our funds depending on what it's for. So we have the option of doing that as well to create a larger pot of money if that's something that Northborough is still interested in.
Yeah, I would agree about the doing this together collaboratively with Northborough. It makes more funds available for the same, like, you know, you can do the same thing with both towns and you have more potential for use of those funds. I think if we combine our efforts because we share a high school, I think that's great. And I think that, you know, when we look at, you know, primary prevention, going down to the real basics, it starts at a young age. And so, you know, incorporating whether we use personnel, youth and family services to really zone in on kids who have experienced trauma, who are more likely to, you know, follow, you know, starting at a young age with a gateway drug and eventually to opioids. So I think those were probably those were two things that I was thinking about.
Yeah. Isabella, do you think that's something that Northborough would still want to pursue?
I think so. So the Board of Health, it would still need to go through the select board in Northborough. So we're again in the early phases, and I know Greater Boroughs is also interested in possibly combining funds. So I think depending on like the project and if we would just need to determine if we needed an additional IMA or all of those little fine details. But I do think especially Northborough, Southborough, the shared school district, I know there's you know, talks about curriculums and different things to focus on prevention. So I think that's a great point. I think I don't want to forget about like Emily's position. So we have the funding for 5 years. We are going to apply for years 6 through 10, but it's very competitive. So I do want to leave some funds possibly to keep her role because truthfully, without Emily's role, none of us, at least in Northborough, have capacity to do all this work. So again, I would like to use funds to extend that position.
Yeah, I would echo that 100%. Like since Emily has started, our coalition's made leaps and bounds in terms of the work it's been doing. So
Go, Emily.
Thanks. Should I like leave this? Is this a conflict of interest? Should I like bounce? Should, like, I don't know what to do.
I think you're good.
Oh, you're good. There's no decisions being made today, Emily.
Okay, I didn't know. I was like, oh.
But yeah, so I think just keeping this on our radar, you know, we don't have to necessarily make any decisions today, but we've been sitting on the money now for a little bit of time, and, you know, I think we need to start really looking into how we're gonna spend it, so. Happy to work offline with anybody who's who's interested and kind of, get some insight from some other people in town as well.
Do you want to have one board member work with you on this, Taylor?
Sure.
I can do that, Taylor, since I'm already part of the coalition as well.
Yeah.
So I'm already embedded in this in
Perfect.
multiple roles. So and with
Perfect.
school. So I think that'll be great.
Sounds good.
All right. Okay, Emily, I think you're free to leave. Thank you so much for putting that all together. And that was a lengthy report. And for anybody who's watching this tape, it is available. It was recorded on one of our Greater Boroughs meeting, I think in June.
I think it would have been the end of June.
It was the end of June. Yeah.
June.
So if anybody wants that, and that's a public document as well. And there's a lot of information in there if anybody wants to look at it. So thank you very much, Emily.
Thank
Yeah,
you.
thank you.
Thanks, Emily. Thanks, Isabella.
We're gonna keep Isabella for a second, I think.
Oh, yeah. Oh, sorry.
If you want to stay, Isabella, for the IMA.
Yeah, that's fine.
All right, so I'm gonna go to
Number
number
6.
6. So there were a few minor changes to the IMA. Taylor and I went to Southborough Select Board 2 weeks ago. And I still had Middlesex because I took a bunch of different IMAs and kind of compiled this one together and added some stuff. So I still had Middlesex County in there, so it needed to be Worcester. And then there were just a few typos in there. And I also added the job description as the addendum because that was just the cleanest way to do it. So Southborough Select Board's voting tonight on the IMA. Northborough Board of Health voted last week on the IMA, and Isabella and I are going to Northborough Select Board next Monday night to have them vote. So we just need to take a position on that. And this is really good timing because our volume of nuisance complaints has skyrocketed. We're like Taylor's getting inundated with nuisance complaints. So I'm not sure why, but that's definitely taking a lot of time as of late. So yeah. So is everybody good to vote on the IMA? All right, so I'll move that we approve the IMA with Northborough for the shared health agent.
Second and vote aye.
Zulikai.
And Malinowski's aye. Okay, thank you. And we will, after Monday night, assuming everything goes well with both select boards, we will post next week. So Taylor has a plan for how to advertise for that position, and then we'll start with interviews.
Chelsea, when for the interviews, would it just obviously it's a Southborough position, so would I be in those interviews?
I think we should, yeah. So I think what we could do, we could have you, Taylor, and a board member run the process.
Okay.
And then kind of what you're doing for the coordinator position. And then we could bring a finalist or two back to be interviewed with the board here.
Okay.
Everybody's okay with that?
Yep. So Isabella has vacation and then would start, we have to wait a period of time anyway, so when she gets back, we can start based off of what we have for applications.
In between all the flu clinics that you guys are doing.
Yes.
And I do trust you all, and Taylor has my schedule for the most part, so if you want to book, or, you know, if, depending on how many applicants you get, if there's, you know, 3 or 4 that look good, feel
Yeah.
free to schedule those, and Taylor just send them to my calendar, and
Yeah.
I don't want to wait. I want
To
this.
schedule, yeah, absolutely.
All right.
That would be very helpful.
Okay. Great. Isabella, I don't think there's anything else on here that I mean, you're more than welcome to stay, but if you have other things to
No,
do.
it's always a pleasure to join the Southborough Board of Health. But yeah, reach out if you need anything, and Chelsea, just give me an update on after the select board, just to see if they voted.
I will. Yeah. Okay. And we'll coordinate for Monday.
All right. Thank you so
All right.
much.
Thanks,
Good
Isabella.
seeing you all.
Have a good day. All right, I'm gonna go back to the top. So approval of the 8/13/24 meeting minutes. Any questions on those?
Nope.
All right, I move that we approve the 8/13/24 meeting minutes.
A second vote aye.
Zulik, aye.
Malinowski's aye. Okay, the executive session minutes from 8/13 and 9/4. I sent those late last night. Did you get a chance to read them?
Yep.
Okay. Do we need to bring them back into executive, or are we good to vote?
Zulik
I was
and-
good.
Okay, so I'm gonna move that we approve but not release the executive session meeting minutes from 8/13/24 and 9/4/24.
Yeah, second and vote aye.
Zulik, aye.
Malinowski, aye. Thank you. Fall town meeting, so that is 9:30. And the health agent and the health director position are both on the personnel board article for SAP changes. So we want to continue to move forward with those so that those employees at some point can go onto the SAP if they're not already. So I am going to try to be there. And if you guys can be there too, that would be great. But just let me know if what your schedule is for that night. So that's 9:30. I think it's at 7.
Yeah, that's 7. Should be there.
Right.
Yeah.
And that's all we have on the docket. So we did the IMA. Okay, Greater Boroughs update. Taylor, do you want to give an update, or you want me to?
Sure, I don't mind giving an update. So we met last Thursday, our advisory board did, and just to quickly go over kind of all of the things that are happening there, we are hiring for multiple positions within Greater Boroughs. We interviewed 3 candidates yesterday for the full-time regional nurse position. And then in the next couple weeks, we are planning to interview for the epidemiologist and shared service coordinator positions as well. Those 2 positions previously Isabella held before she got promoted to Health and Human Services Director. So she'll be leading those interviews with another person from the advisory board. They had the opportunity to combine those positions again if people were interested, but they were posted as 2 separate positions. I think she got 5 or 6 candidates and they were all interested in doing both. So that's actually great news. And then also just busy planning for flu clinics. Kind of going out of order because it overlaps, but we have a drive-through flu clinic on Saturday, October 19th at Algonquin for any resident or worker, school personnel in Northborough, Southborough, or Boylston. It's a pretty popular clinic. You drive up, you get your flu shot, you stay in your car, and then you leave. We normally do about 300 to 450 vaccines in that morning. So it's usually pretty successful, and we're always looking for volunteers if anybody wants to help with that. Anything that I missed, Chelsea?
Would you say the date on that is, the clinic?
October 19th. And we're
You wanna
getting
talk-
ready to push something out to the public about that soon.
Do you want to talk about the COVID vaccines?
Sure, you want me to do that too? It's not related to Greater Boroughs.
Oh, okay, that's fine. Sorry, I thought you were just gonna skip around, but that's fine. We'll wait.
Oh,
until-
I can if you want, I don't
Yeah,
care.
go ahead, just while you're on this. On
Okay,
the
so
topic.
not related to Greater Boroughs, the town of Southborough is still hosting their annual flu clinics. I've started to push out information on that, especially our senior center clinic, as we do mostly high dose flu vaccine for that. I've been getting a lot of questions about if there is a combined vaccine for COVID and flu. There's not, has not been approved. And then we also are looking into trying to order a small amount of COVID vaccine. I'm looking into pricing for that. Our revolving account lets us spend up to a certain amount of money, and we're kind of close to that already based off of what we spend annually on flu and flu vaccine supplies. So we're looking into that to see if we can afford to get a small amount of vaccine and kind of trial if people would be interested in that or not.
So, and then for next year at annual town meeting, we can increase our spend limit. So right now it's $15,000 and we spend, how much do we spend on flu? Like,
A little over 10,000.
so, and COVID vaccines are pretty expensive, although you get reimbursed plus an admin fee. So it's actually, it's not really a spend issue as much as it's, we just are capped at how much we can spend per the, what we requested at town meeting. So, so we'll bring that forward for town meeting, but at least if we can get a few for this year and just see what the demand is like, because I don't want to, Taylor doesn't want to spend a lot of money on COVID vaccines and then not have, have people not take them.
We did also discuss it briefly in our Greater Boroughs meeting, and some of the towns had reached out to residents and there was not a lot of demand for them. So I have not had a lot of inquiries about it, but I've had a handful. So I will reach out to those people who asked, and then also see if anybody else is interested.
Thanks, Taylor.
Mhm.
All right, number 8, approval of updated addendum for business administrator 1. So, Barbara had sent that over. Do you want me to pull it up on my screen?
Sure.
You guys see that?
Yep.
Do you want me to talk about this quickly?
Sure.
All right, so Barbara has added a few things to her job description that are new for her, and just to keep track so that she always has an updated, essentially added job description to her resume, which is included in this addendum. She had asked if we could just continue to update it as she gets new tasks. That way, if personnel board ever reviews the document, she would already have a running list of everything that she did. So this is with the additions. And Barbara, if I missed anything there, please let me know.
Nope.
So I'm okay with the substance of it. I think there were just a few typos that if you guys are okay, I just want to go through and correct. So if we can, unless there's any other changes, I'll make the motion so that I can just update the typos.
I was okay with it. Yeah, I'm okay
Yeah.
with it.
That sounds good to me.
All right, so I'll move that we approve the job addendum subject to any Scrivener's errors in the document.
Yep, my second vote, aye.
Zuluk, aye.
And Malinowski's aye. Thank you. All right, next is trash hauler regulations.
I just resent you those, so if you don't mind pulling
Okay,
them up.
sure, yeah.
I think I sent this document out last week. And we
Need
kind of,
two documents. Which one do you want me to?
one says attachments, one is the document
Oh,
itself.
got it. Yeah, okay, thanks.
So we had kind of started doing this right as Dr. Alker was leaving, and then it got tabled for a little while. So Chelsea and I spent quite a bit of time going through the state sample document and then the document that Westboro created, and we kind of took things from both. There's a couple things in here that I just wanted to get the board's opinion on, and they're all highlighted in yellow. So if you go back up, Chelsea. Okay. We just need to figure out a date that they'll be effective on. I don't know that we need to do that today, but I need to speak to council about a couple things, and office hours aren't until tomorrow. So I'm hoping to meet with council tomorrow to get some of these clarified, but then we would have a better idea on when we would want the regulations to take effect, unless we just wanted to say like the beginning of the year. So just the board's opinion on that. And
Okay.
Barbara as well, because she'll be implementing the,
Yeah,
They
that's
all
just,
renew on January 1st.
they all renew then?
Mm-hmm.
And
It
when
has
do you get, or when do you send something out to them, Barbara?
December.
Okay. So that makes sense to me, is to have it effective January 1, because we should have, assuming that we have this done in October, then that gives you enough time, Barbara.
Mm-hmm.
okay. This mandatory recycling, I also got feedback from Bill Cundiff, the DPW director. And he just said to reach out to council about this part. So this is one of the pieces that I just need to speak to council about. Also, we need to just decide a fee, unless we already have one, Barbara.
$300 a year.
So I'll insert that.
And I feel like we looked at our rates, Barbara, probably a year and a half ago.
Yep.
And compared to other towns, and I think we were totally in line.
Mhm.
So,
And the board's good with 30 days to rule on granting a permit.
I think that gives you enough time, right, Barbara?
Yes, that's perfect.
I think that's fine.
On this next page, we had talked about, so the language was business owner, but we had talked about adding designee. I just wanted to confirm that was still okay with the board for a signature.
Yep.
Fine by me.
This goes along with the above that I just need to speak to council about. And then the fines, if you want to scroll up a little bit, I didn't highlight this, but these are for the offenses. So if we had any thing that we need to enforce, these were kind of the fee schedule that was suggested. So let me know what you think about that as well.
I think that looks reasonable, and I think we'd compared it to other towns, right? So I think we were
Correct.
pretty much in line with what.
And
others-
this is the fee schedule that Westboro implemented.
that looks reasonable.
Okay. Thank you.
Thank you.
So we'll put this on the agenda for October, and maybe after you meet with council, if you just want to send a final draft to Bill Cundiff, and then we can just
Yep.
make sure we're good. Okay,
Definitely.
thanks, Taylor. Body Works.
So one of the things that has been requested for the health department to look at is body works regulations. So not sure if the board is familiar with this term or not, but basically body works is another term for a place that does massages that does not require the state's like a massage license from the state. They're becoming more and more popular because they can essentially get around like the regulations of massage parlors because they're not saying they're doing massages. So a lot of towns have started creating body works policies to regulate these types of places. We do have one in town right now that's new. And then since then, we have had a request to look at implementing a policy. So I have been gathering policies from other towns to review and kind of start working on a policy for our town as well, which would oversee and kind of create our own regulations around what can and cannot be done at a body works facility.
So it's really unfortunate that the state doesn't have
So
regulations.
why do they allow this to happen?
It's kind of so it's a gray area.
Mhm.
Basically, you know, people have found a loophole in the way that a massage parlor is worded and regulated and then worked around it.
Yeah.
And as far to my knowledge, as far as I know, the state has not done anything to update their wording or their regulations. So towns are starting to create their own. And then a lot of towns have found once you do this, it kind of fends off newer businesses of this type to apply because you're essentially creating the same regulation as the state is. And they don't have the credentials to be able to continue operating.
Yeah.
But there's some good models from towns.
Yes.
You know, some, you know, it's tricky, right? Because we obviously don't want to limit business in town, but
Right.
you know, there should be certain requirements that should be in place.
Safety, cleanliness. Yeah. We a lot of, yeah. So I think it's important to look into. One of my concerns was, you know, when we were approached to look at these was there is no formal training for local boards of health to do an inspection on body work. So there's no training on it or how you would do an inspection. But after looking at other towns' policy or regulation on it, I think we would be comfortable with implementing a policy similar.
And the Board of Health has the ability to do this without town meeting, so we can adopt our own regulations
Yeah, I think
or
it
state
means
statute. Guidance.
if there's a great town, if there's someone's already done this, then that's great. We can look at theirs and
Yeah, there's quite a few towns that have started to implement this. Most recently Weymouth and I think it was Medfield, and I can double check, but I did reach out to the Medfield health director and she supplied me with quite a few that she based hers off of, and I do like the ones that she has adopted in her town. So and she was happy to share them and let me use them as a basis.
So more to come on this one.
Yep, but just so that it's on everyone's radar.
Okay, I think that's it. You don't have anything else to add on the clinics, right, Taylor?
Nope, I've reached out to all of the schools, public schools and daycares in town to set up clinics for the teachers there. Heard back from quite a few of them already, so
Great.
just getting those on the books as well.
Awesome. All right, do we want to pick, do we have October?
We did.
We do, okay, no, October 7th at 11:30, is that still good for everyone?
Still good.
So good.
What about November? Remember, we have a lot of days we can't meet because of.
I was just gonna say, there's a lot of days we can't meet in November.
Oh, yeah.
Sorry, what are the good days for you again? Tuesdays and Wednesdays?
I can do Monday mornings and Tuesdays.
We
So
can't do the 5th and we can't do the 11th.
What about the
What
12th?
about the 12th from 11 to 12?
That's good for me.
let me just double check, and that is good for me as well. Perfect.
Taylor?
Yeah.
Barbara?
I think someone just walked in.
Okay. All right, we'll do that. Okay,
Great.
well, thank you very much. Anything else or any public comment? Sorry. Nope. All right, so I move to adjourn at 9:57 a.m. We made it under an hour.
Good. Good job.
I wasn't sure with this agenda,
I
but
know,
I
this is
second
this is an ambitious agenda.
I know. I second and vote aye.
Zuluk, aye.
And Malinowski's aye. Have a great day, everyone.
thanks
Thanks, guys.
everyone.